Yeah, just to let people know, I'm going to record the session just in case anybody else has missed the session and wants to watch it later. So thanks for joining us. I think we'll probably have a few more people signing in over the next few minutes. So thanks for coming along to our session on the Ealing Small Grants Programme. So yeah, just as introduction to start off with, I'm just going to give a general introduction to the fund before handing over to John and his colleagues from the NHS, who are going to talk about the mental health and wellbeing funding priorities. Because the fund is basically, well, there's Ealing Council working with the West London NHS. They've allocated £100,000, and half of this funding is for projects working with mental health and well-being. So there's slightly different priorities. So because John and his colleagues have to leave slightly earlier, they're going to do their presentation first, just to talk about the health and well-being priorities. And then afterwards, there'll be time for question and answer to them. And then I'll go and do another presentation just on the eligibility criteria and some tips that the council have provided on how to write a good application. There is no one actually from the council themselves doing a presentation, so I'll be doing the presentation about the Ealing Council priority areas and eligibility criteria. So I will just get John and the NHS presentation up. Obviously, you can also introduce yourself in the chat. Say which group you're from. I think people are still joining.
Bernard.
Thanks, Ian.
So yeah, John, over to you.
Thank you very much, Ian, and thanks everybody, and good morning, good afternoon, and welcome to this this presentation. I'm just going to introduce myself first, and then I'll get the Mint team managers to introduce themselves, and then we've just got a brief presentation about the changes in mental health services in Ealing, and a little bit about the plans for bids and the criteria for bids, and then a bit of space for some questions. So I'm John Luff, and I think I may have met a few of the people in this group already via the voluntary group, the groups that Dan and Craig chair. But for those that don't know me, I'm a service manager in Ealing community teams working for West London NHS Trust. And I'll ask Will to introduce himself next, and then Dan, and then Craig. Thanks.
Thanks, John. Hi, everybody. My name is William Balehash. I manage Ealing Acton Mint Hub based at Avenue House, which I hope some of you will know. And obviously, I work in Ealing Community Services and report to John, actually. So, hello, that's me.
Thanks, Will. And Dan, are you?
Yeah, hi, I'm Dan Stockwell. I'm Will's contemporary, but I work in the north of the borough. And we're just setting up a team there at the moment at Grand Union Village. So I'll be managing the North Ealing Mint team.
Thanks, Dan. And Craig?
Hi, everyone. My name's Craig Ballantyne, and I am the Mint Manager for Southall. So some of you may know the Lines. That's where we're currently based. And I'm a mental health nurse by background.
Thanks, Craig. I suppose it's worth just pointing out at the beginning that I think all four of us from the management team are mental health nurses as well. And the other thing to say is that unfortunately Craig's got some connection problems, so he's on his phone at the moment. So we'll just do our best with the IT that we've got and continue. Okay, Ian, would you mind moving to the next slide for me? Great. So for those that don't know, I'll be quite brief about this because you may have seen this presentation or something else like it at the beginning about mental health services in the borough before, and we've got time for questions afterwards. So what broadly, what's happening, not just in our borough, but in 12 trusts across England, is that we are changing how we deliver our community mental health services completely. Really big transformation going on. And what that means on the ground in Ealing is that we are amalgamating, we're taking our community recovery teams that you know very well and our primary care mental health teams, and we're joining them together, that resource together, along with some extra resource that comes from NHS England to boost that. And the point about why we're doing that is that we need to refocus how we provide our mental health services in the community around, for adults, around linking closely with the primary care networks and the GPs in our borough. So we want to link all services around that. And as well as GPs, other providers, including yourselves, voluntary sector partners. The other thing that we want to do is we want to make our service users' care easier to access for them. I'm aware from some internal trust data about quite a large percentage of calls to our single point of access number over the last 2 years, and that's over 50%, have not gone on to getting a referral into our secondary care mental health services or our primary care mental health services. So we know that there's a big untapped mental health need out there in the borough, and we are trying to reorganise our services in order to make sure that we've got some sort of timely intervention that we can offer people that is suitable to their level of need at that time. And this is all, the driver for this is all about NHS England's long-term plan and the resulting community mental health framework document, which sets out how we need to we need to provide our services around the patient and around the primary care networks and existing voluntary care services. I'll move on to the next slide, Ian, please. Thank you. So the main aim of these, I didn't say the title, did I? Mental Health Integrated Network Teams, which we've shortened to MINT because it's a bit of a mouthful. It's very popular with some people and not so with some others, but MINT drips off the tongue quite easily. And the whole point about that is trying to change what we did in the past about long waits for people to access care that met their needs. So if you think about secondary care services or our recovery teams, the waiting times that were mandated for us were 12 weeks to see somebody after referral, and sometimes that went quite a bit longer, unfortunately. In MINT, in this new way of working, we're aiming to be able to see everybody referred to the community teams within 4 weeks. The other aims are, we'll see that person more promptly. Ideally, we'll see that person locally to their primary care network or their GP, and we'll be able to offer an intervention that meets their needs. Now, I'm fully aware, and you probably all are, that previously our services were set up on a very medical model. So everything would be going through an outpatient's consultant with a psychiatrist, and we know full well that people's needs are more complex than that. So people have social care needs, psychological needs, as well as medical needs. And the model that was a biopsychosocial model I need to get this the right way around. We're hoping to change the way we say that and think about that to a social biopsycho model. So that's what we're trying to achieve. The other things we're trying to achieve with Mint is to reduce some of those barriers between separate parts of our services. So someone who's seen the GP and needs to come to primary care, very often there's a big assessment process, and then if they need to come into secondary care, then very often there are other hoops that people need to jump through in order to get the right service. The aim of this is to provide an appropriate needs met intervention as early as possible via the one place, the Mint team, or community partners like yourselves. Okay, can I move to the next one, Ian? Yeah, so I'm aware I may have spoken to all the slides in the first few minutes, but never mind. So the important thing about this one is that we're aware of so currently we have primary care mental health services in the borough. So we've got, I don't know, 6 nurses looking after the borough of 8 primary care networks and 450,000 people. It's nowhere near enough resource for for the need that's out there, and we know that. And what we aim to do with Mint is we aim to enhance that light touch advice and guidance part of the service. So if someone's under a GP's got a query about somebody's care and treatment, with placing our services around those GP networks and improving those relationships, we aim to be able to, give corridor advice, light touch, help about guiding that person's treatment and interventions. If the needs are not too complex, if they are complex, those referral pathways will be far quicker and more seamless than they have been in the past, because referrals will be coming via System 1, which the vast majority of our GPs use in the borough. I'm just thinking, is there anything else I need to say about that? No, I don't think so. I think what I'll do is I'll wait for questions at the end, and I'll hand over to Will, who I think is going to present the next couple of slides.
Thank you, John. Ian, could we go on to the? Can we go on to the next slide, please? So yeah, I think John's given you a really clear headline or introduction into what Mint is, if you haven't seen that already. And I believe that Dan and Craig have also done quite a lot of communication work or advertising work around Mint in the mental health forum every month, which I've attended a couple of times, I believe. I won't go into too much detail about eligibility criteria and which groups the local authority are looking to fund and which groups they aren't looking to fund, because I think Ian will do that in his presentation a bit later. Is that right, Ian?
Yeah, that's correct.
So I won't bore you with that now. It is all in the prospectus and well worth a read. As you know, that there's a grant of £100,000 for 2021-2022 to support voluntary and community sector groups to deliver local community and neighbourhood projects. And I think some of you may have applied for funding last year, and I think this looks like a continuation of that into this financial year. In mental health, we have and learning, we have 5 priority areas, and on the next slide I'll talk about those in a little bit more detail. I think the other thing I wanted to say about Mint and the transformation that we're going through in West London and in those other trusts that John mentioned is we recognise that while we have a very key and important role to play as the NHS and as providers of mental health services, we need to work with our partners, and in this situation, that's you guys, and the work that you do. So I have a lot of conversations with my medical and my psychology and my nursing and my OT and my social work colleagues here at Avenue House, thinking about how we can better integrate and better work with all of you, so that we can all work together to meet the needs of people who are suffering in our borough. So I think that's a fundamental aspect of this work and what we're trying to achieve today. Can I move on to the next slide, please? Thank you. So these are the 5 priority areas that I think half of the fund is devoted to. So I think there's £100,000 and 50,000 of that I think is aimed at these specific priorities, and the rest is a bit more open. So I've got something on my screen just popped up. So the first one, obviously, essentially what I'm going to do is read the slide to you, because I was going to do a lot of stuff around eligibility and access and how to apply and all of that, but Ian's going to cover all of that, so I won't bore you with it twice. Essentially, we're looking to support people with BAME, the BAME population, to engage with local services and activities and everyday life. The next key priority for us is culturally appropriate support to those residents who've experienced trauma, specifically or particularly trauma related to migration and where their first language is not English. So BAME and then trauma. The third priority for us is LGBT+, and ensuring that people who identify as LGBT+, are accessing support and help and mental health wellbeing services locally. We want to empower community members and increase engagement with health services, creating safe community spaces and reducing stigma related to mental health through education. So anything that drives up population understanding of mental health and reduces stigma is going to be really valuable. And then finally, working with people who sort of sit on the edges of mental health, if you like. So people with a comorbid physical disability, or with a comorbid learning disability, or with a neurodevelopmental problem. Certainly a frequent feature of clinical conversation at Avenue House is around neurodevelopment or neurodevelopmental disorders, and what we can do to help and what other services can do to help. And again, it's about providing supportive community spaces and helping residents to engage with health and local social service activities. So those really are the key areas, or the prime priority areas. I'll just repeat them again. So it's BAME, trauma focused on migration trauma, LGBT+ groups, safe spaces for community members around empowering and reducing stigma, and then those key areas of physical disability, learning disability, and neurodevelopmental disability. And I think that really draws my bit to a close. As I say, I was going to give you a whole lot more on eligibility and where to apply and all of that, but I think Ian will do all of that. And I will pass you over to, I think it's Craig next. Is that right, Craig?
Yeah, it's me. So, thank you. So as part of the sort of project, something that we need to think about as well, or you'll need to think about in your bids, is how are we gonna know that there's been an improvement or there hasn't been an improvement, and we need to find ways of ensuring that we're measuring that, because one of the shifts that we're trying to do as well in the NHS and under MINT is we are using a lot more kind of data as well to find out where we need to intervene, or using it to evaluate our own services as well to see if they're meeting the needs of the local population. So there would be an expectation within your bid to sort of evidence how you're going to do that. And for people that aren't familiar with that process, don't worry. There's some suggestions on this slide for you already. And within your application process, there will be further help if you are struggling with this area. So it's just something you need to consider. You may already well be doing it, but it's just something that to consider in your application is quite an important part. And even when we're thinking about measures, as I've said, if you get the money and we don't see an improvement, that's okay. It's just important that we're able to get a good picture of if our services are working or not. I don't think there's really too much to really say on this slide. You might have further questions later, but that was it for me. Just a short one slide. Then I'll hand you over to Dan.
Thank you, Craig. So, yeah, so just in terms of the data that you might want to collect to measure who you're helping, this is quite important because I think, as John touched on at the beginning of the presentation, there's groups of parts of the population of Ealing that actually that they found it quite difficult to reach us, and we haven't been accessible enough to them. And so we really need to make sure that we're able to reach those people, and we're doing something in the community to help them, and to kind of change the way that we're working as well. Because I think that whereas before we've been kind of managing things in a kind of a crisis level, actually we need to have more of a preventative approach and kind of early detection and early intervention for people, and to be just really accessible. So when we're looking at kind of beneficiaries, this is the kind of thing that we're kind of looking at, where are the groups of people that that mental health services have found difficult to identify and reach, and how can we best support them. And that's one of the things that we want you to be thinking about, in terms of measuring the bids, measuring the people, the beneficiaries. Also as well on there's around indirect beneficiaries. So that can also be, not necessarily patients that we help through this, but also carers as well. Carers are such an important part of the work that we do, and they can sometimes be forgotten about, to be honest. And we really need to work towards making sure that we're able to kind of address the needs of carers as well, because they we rely on carers a lot in terms of the way that we operate and the support that we have for our patients. And the other part of this as well is around face-to-face contacts, which is a really kind of hot topic at the moment as we're coming out, hopefully, at the other side of this pandemic, and where we've been quite reliant on, telephone contacts for patients and digital methods of contact for patients. But actually, there are patients out there that have kind of poverty of digital technology, that we haven't been able to reach, and therefore, we need to make sure that we're kind of continuing with face-to-face contacts with patients as well. So that's quite key for us. And yeah, just going on to that other part, one of the reasons why patients have found it difficult to reach us, and we found it difficult to reach patients, is because of the language barriers. And that's something that we really need to change as well in our services and make sure that we're more accessible. So that's why it's another key aspect on here as well. So that's it for that slide. Thanks, Ian.
Thanks, Dan. Thanks, Craig, and thanks, Will. And I think that's the end of our short presentation. And I just wanted to, so thanks all for listening. But we're really keen to sort of try and address any questions that people may have. And first of all, I can see one from Daisy in the chat, which is, will preventative and early intervention be considered as a key function of your groups if your group reaches some of your priority groups? So yes, I'm hoping that our closer working with GPs and our closer working with you guys in the voluntary sector and other services around the borough will help us be more responsive to any queries or questions you or GPs may have, so that we can help with that early intervention, often light touch, in a responsive fashion. So I'm really hoping that we can improve on that, and of course the health promotion work that we need to do with our GP colleagues as well. I don't know if the others have got any comments or anything else you wanted to say about that.
No, I can come in on that. Hi everyone, my name is Wanda. I'm the Transformation Programme Manager for Community Mental Health Services. So some of you might have seen me if you joined the Hounslow Wellbeing Forum group with the VCSE and third sector join there, or even in the one that Toby runs as well. So just to answer a couple more questions, prevention is such a key aspect, and being able to engage people early on when they start to feel slightly unwell, or they're unsure about their feelings, or feeling anxious or slightly low in mood, or need to feel isolated. Prevention is such a big aspect. really what we want to do is prevent people from having to even need to come into services. That is such a big aspect of trying to keep people well in the community. So yes, Daisy, 100% prevention is important. Is it Kalita? She's asked, is there funding available for children rather than adults? So this specific bit of funding is for adults because the main aim is adults or young people who transition, so sort of the 17 plus. If we're looking more holistically at adults and families and children, if the offer is going to be looking at adults who have young children, then I suppose that's a carer aspect, so then you could possibly apply for that. But it is mainly for, the offer should mainly be for adults. There is further work taking place with other service lines that look at children development as part of the long-term plan for mental health, but this specific one is based around adults. Is tackling adult literacy a potential goal for this funding? Yes, so if you look at a large population of Ealing are BAME, where their first language is not English, and that can be really challenging if you've got coexisting mental health needs as well. So how do you talk about medication? Who do you go to? How do you discuss that locally if it's really challenging to get out and about and if you're isolated? So it can be literacy related as well, but don't forget that the focus is on addressing mental health needs too. So how are you supporting that in that aspect as well? Our organisation is based in Hellingdon. However, the community we serve primarily based in Ealing and Hounslow as well as Islington. Can we still apply? Yes, you can. You have to be very clear though exactly which population you are serving. So just as long as you've made that clear on your application form and what you're aiming to do. And again, this funding is particularly for Ealing, so making sure that whatever you're delivering with this specific thing that you're applying for is targeted towards the population of Ealing. That would be really good. Neil.
Thank you. The organisation I represent here is Mixed Martial Arts for Reform and Progression. We work solely with deaf, blind, disabled, disadvantaged youngsters in the age ranges you're talking about to promote well-being, amongst other things. That sounds like something that is very much in the middle of what you're looking at, but I can't quite see how particularly back the NHS is offering in terms of mental health. Can you see how we do that? Because we work closely with those people. We have in fact done some work for Ealing in the past, but I'm trying to work out how we link in with your measures, I suppose.
So I suppose if you're thinking about a measure, I think on the presentation we talked about the short Edinburgh and Warwick scale as a short version, and you're asking about people's experiences. Does that link to mental health? So if you're asking them to complete that before when they join, and perhaps at the end of their number of sessions that they'll do with you, you have to see, are you supporting them with the mental health? Maybe it's a specific question you want to answer. Are you coming here because you're dealing with stress or anxiety or something like that? And that could very much be a question that you answer. And then the second question that you might ask them is, did you find this group helpful? Sometimes a patient-related experience measure, the formal term for it, is something as simple as asking 2 questions, yes and no, and asking them how much has that helped you on a scale from 1 to 10, you know. And this is where we think that, you know, as much as our work within mental health is therapy based, so much more is therapeutically based, which is some of the work that you're probably doing. So just have a think about what questions you might want to ask to see if that's the function, and then you've got a clear measure that, are you supporting somebody with mental health, but also you're providing that information to us. Our long-term goal is, if these applications and this work is successful, we have a case to say to NHS England, we want to have continued funding through the long-term plan to continue to fund organisations within the voluntary and third sector. This is where care should be kept within the community, where people feel safe, where they feel connected, and not feel institutionalised coming to a service. So we're hoping that this makes a real positive change, and working with the mental health team quite closely, sort of dissolve the barrier of how that comes across and the stigma that's associated with it. So some of your bids might want to consider awareness raising, you know, reducing stigma and association with mental health services and what that means. Sometimes talking over sports is how people bond, talking over gaming is how people bond and discuss what's going on with them. So there's multiple ways to consider that.
Okay, a lot of ours are autistic and you know, they have difficulty answering the question. So, thank you.
So can we apply for digital as well as face-to-face support to disabled through advice support on issues related to welfare benefits health during this pandemic? I would say so, as long as you're specifically saying how you're targeting towards the Ealing population and what specifically are you supporting through in terms of mental health. Do read the guidance on this, because I'll try and answer as many questions as I can, but the guidance is much clearer on what you can and can't apply for, so do have a read of that.
I think Lolan has a hand there, Wanda.
Hi. My name's Lolin. I'm from HeartLink, the Heart Support Group. Can you hear me?
Yes.
Are you able?
Yeah.
Hi, thank you. We have 200 to 300 members, all heart patients, covering Ealing, Hounslow, Hillingdon, all the neighbouring boroughs. We're based at Ealing Hospital. We are a support group. We are not a charity. So my first question is, would we qualify under your criteria if we applied as a support group?
So it would need to be clear exactly what you're applying for, and the guidance will tell you how to do that. As long as you're being specific of how this is integrating with the physical and mental health initiative and how you're going to support specifically that group or what you're developing specifically using this funding, then yes. It does say, the guidance does say, you know, it's not for maintaining ongoing projects. You have to be innovative and thinking about how we're addressing these priorities and what are you doing specifically to try and do that. And it might be something that's already in existence, but you're trying to build on something new and reach people that have never really been reached before.
Yeah, I mean, our priorities, obviously, a lot of the members are of the older generation. They are from a very diverse mix, lots of from ethnic minorities. There is a big stigma amongst them attached to mental health. They won't accept that they've suffered, but they are suffering. When you're diagnosed with heart disease, the doctors fix you. They fix you and they discharge you, and that's it. There's nothing to pick you up. Their carers suffer a lot. They suffer, and through COVID, the last 18 months, you know, they have really been through it. They're also discriminated against because a lot of them don't have technology at home. So whilst they've been having telephone conversations with their GPs and their hospital appointments, they're not able to do Zoom calls. They don't have smartphones. And I know that our trust here, one of their key goals is health inequality. And straight away, my members fall into that group because, you know, a lot of their families do help them, but not all the time. So, you know, they don't fall into your traditional mental health group, but they do fall into that category. So that's where I would be interested in to help them. Thank you.
Thanks, Lolina.
Lolin, thank you.
Sorry, I'll get there in the end. Lolin.
Fine.
So I think, you know, the aging population are really often forgotten about in terms of their mental health. And I think there's a huge amount of stigma to accept what do we mean by mental health. And sometimes that is having a difficult day. It's okay to have a difficult day, but it is having a difficult day or feeling isolated or not knowing how to ask for help. And that is a generational difference between the populations and understanding what that means. So within Ealing, we know we have a huge aging population as well, particularly linked to a couple of surgeries. The Argyle PCN is one of them. You know, so I think definitely if you're going to apply for it, you know, you've articulated what the difficulty is in terms of mental health. Put it down on paper. You know, we are trying to address the inequalities and a marginalised group of our older people. We often forget that those subtleties exist. Can the application be circulated? So I think Ian's going to come on to the guidance and the documents for all of that. But you can definitely have the slides that we've shared to help you do some thinking. Neil?
Thank you. Another question on the sort of level of grants. I haven't read the background information, but we don't need much to run a club. You know, £5,000 would get us to do an entire year. Is that the sort of size of grant you're looking at, or are they different sizes than that?
You can apply for different sizes. I think 5 is up to the maximum, and we are looking to see how long you can run that. Be very clear in your bid how many people you want to, or you aim to support in that, because we would want to measure against that. And obviously, if more funding is needed, and the next year we need to review, actually, do we need larger grants, etc. Those are things that we'll need to discuss with our council colleagues and things like that. But just be clear about what you're trying to achieve, how much you're asking for, and where it's going to go. Just
sure. I mean, clubs are about 20 to 30 in size maximum. You can't have any more than that when you're doing what we do. So it would be that sort of numbers, but maybe if it was successful, maybe twice a week or something, I don't know.
And it's very different depending on the type of offer. So if you're offering an open rolling group, you can have, and it's digital, you can have lots of people. You're doing one-to-one work, or working with families, or working in small groups, so you need one-to-one attention. They're going to be a lot smaller, and you'll reach capacity sooner. As long as you're clear about what you're doing and why, then you've stated what the purpose is.
Yeah, ours are classes, so it's physical classes. People come along and train, so it's limited. Thank you.
Just trying to read some of the chat while it's going along. So Nayoka.
Oh, that's me. I'm Nyuka. I'm the Funding Group Development Officer for CVS now. We had a question there of the information being sent out and passed, so I just responded to that. And there's another question on 50% being targeted. We've discussed what the 50% of the fund is going to be used for, and I think Sarah wanted to know what the other 50 would be targeted at. I think we'd get to that in Ian's presentation and know more of that. So that's coming up soon. Any other questions for Wanda there? Lauren?
Sorry, could I just ask, what's the deadline for the application?
The deadline is 12 noon on 19th of July.
Thank you. Thank you.
So, yeah, Poonam.
Sorry, hi. I had a few questions, but I didn't want to kind of take up too much time. So I thought, is it possible to speak one-on-one perhaps later to is it Naoka or yourself?
What would this be with regards to?
Regarding the bid? It's just exact. I had a few questions, so I didn't want to kind of take up too much.
I mean, does it relate specifically to the mental health, well-being side of things? I think it might be the NHS staff might have a better idea how to answer that.
Okay, sure. I mean, one of the things is I've been running writing for well-being sessions, and usually I've been doing them on a private basis. But the thing is, I kind of recognized a need that there are certain people that felt that they weren't aware of what they're like or what they work like, and particularly in the case of BAME women. And I've noticed that I've had sort of like an increase, but I think one of the things that kind of came out from that is one of the comforts that they're coming from. And this is talking about these subtle things that you don't necessarily realize, that even though some of them are able to articulate themselves in English well in terms of perhaps speaking, they hesitate with the writing, and they have found this to be particularly useful. And one of the differences is also the person who's delivering it is myself, that even though they know that, yes, I'm always communicating in English, I am also able to speak in Hindi and Punjabi as well, which has been very helpful to them. And I've noticed that people who come to these venues, to my sessions, normally would be 90% would be a white audience. But because they're aware that I've now started running these sessions, it's starting to attract women, BAME women. And I kind of wanted to think that perhaps that might be useful. And I had a few questions around that. So, you know, perhaps if this would be of interest, that I could, you know, talk about it a bit more.
Sure. So what I'm hoping to do is, if there is enough interest, I've put on the slides, and maybe Ian will share that after, we have a generic inbox. That's just so my personal email doesn't get flooded and I don't miss your emails.
Okay.
But if you email the mint@westlondon.nhs.uk inbox, sure, and just put as the title Ealing bids or Ealing grants program, it's fine. and then state what your questions are. And what I'll try and do with John, Craig, Dan and Will is set up some slots where we can try and meet with you.
Sure.
So we'll try and get to everybody, but if we don't, because obviously there's work going on with Mint and there's clinical time, so
Sure.
I know time's really tight, but if we offer some slots and people are available and want to talk, then let us know, and then we'll try and arrange something over the next few weeks.
Okay, brilliant. That's great. Thank you.
Questions.
Is there any more questions relating to the sort of mental health priorities?
Hi, Ian, it's William Balehash here. Can I just very quickly chip in? There was a question that popped up earlier in the chat about, I think from Neil Jones, will you be referring people to us if we establish a club in Ealing? I think certainly for me at Avenue House, the short answer is probably no. I think my clinical team here wouldn't be looking to make direct referrals to small clubs or any other service. What we have been doing as part of the Mint development is employ people called link workers, and their role very much is to understand all of the offers that are available in the borough. So I'm very hopeful that at the Mental Health Forum we can start having our link workers present at that forum, and you can get to know them and they can get to know you, and then when we see something or someone who comes across our desk, if you like, or across our eyes, we can think, maybe that creative writing group that Dr. Poonam runs is a good thing. Maybe that club that Neil Jones runs is a good thing, and we can signpost and support that individual to access that club. So I'm not thinking that we would want to make direct referrals to a small club that has space for maybe 15 people, but we would want to know that those things exist, and have a way of highlighting that to the patient in front of us. The other thing I wanted to pick up on, I know in my part of the presentation, I talked about the 50-50 split. Now I'm going back through the prospectus, and I think I may have misread that earlier. They talk about in there, if we funded you in 2019-20, we will only fund you for 50% of your programme this time round. So Ian, I'd ask you to kindly clear up any mess I made in your part of the presentation, please. That would be really, really helpful. That's the bit I wanted to say. Thanks.
So I just share with you all before we finish on questions. We did this work with Hounslow, and their offer is up and running. So they have 6 successful bids, and we do signpost to their organisations and help promote the work that they're doing. And this is to increase grassroots, to have a stronger place and voice of what they do within the community, and to connect people and keep well. So we will be helping do that as well, and linking you up with the local Mint teams for anyone that's successful. So you can discuss if there is anyone being seen by you, and if they signpost as well. So hopefully that all works out well. And good luck to you all.
Okay, any more questions about mental health wellbeing priorities? Okay, if not, I will go on now just to cover the information I'm going to talk about is all in the prospectus, and obviously I'll circulate the link to the prospectus and the application form. I'll also circulate the slides we just had on the health and wellbeing and the Mint program to everybody. Sorry, just get the screens out. So yeah, as been said, the funding is for both Ealing Council and West London NHS. So there's 100,000 in total. About half is going towards mental health wellbeing projects. The other half is not so specific in terms of the priority areas. You can apply for up to £5,000, and deadline is, as I said, 12 noon, 19th of July. So you can be not-for-profit organisation, working working to support Ealing residents, but you must have an annual income of less than £50,000. They're not going to fund statutory providers, local authorities, individuals, sole traders or partnerships. Your group does not have to be formally set up when you make your application. However, you do need to have an organisation bank account to provide the funding. And if your organisation is a branch of a larger organisation, you should confirm that you are independent of them before you apply. The project should be delivered to Ealing residents and communities, have a start date that is at least 6 weeks after submission of your application, be a new project activity or a clear expansion on something you already do. And they're saying only one application will be accepted per organisation. And as we said earlier, if your organisation was funded as part of the 2019 programme, they will only fund 50% of any similar project in 2021-22. So no organisation will be funded for more than 2 years for the same project activity. So they're looking for projects that will benefit the local community. Some of the examples they've given are projects such as older people's coffee mornings, arts and cultural events, activities, intergenerational projects, health and self-care support groups, peer support groups, exercise and healthy walks, horticultural environmental projects or initiatives to tackle digital exclusion. The key will be that the projects will be local, led by local people, organisations meeting the needs of local people to improve lives, health and well-being in the neighbourhoods. So as has been said, and we've covered these priorities already, half will be focused on mental health and well-being. And those priorities were all covered a bit earlier. They won't fund ongoing core running costs, including salaries and office costs. They may, however, fund any additional staff or room hire charges necessary to deliver the specific project. And this must be in addition to the usual expenditure of the organisation. They won't fund 100% of the project costs. So basically, organisations are expected to make a contribution to the overall cost of the project, whether financial or in kind. This includes things like volunteer time. So obviously, most people have volunteers. You can calculate volunteer time using things like minimum wage or London living wage, free use of space, etc. And you can go to do something good to get an idea of the kind of things you can do. They won't fund project activities targeted towards political or religious agendas that create barriers to equal access and support. Activities only benefiting an individual. Projects involving construction or refurbishment of property or fixed items of equipment. Projects that take place or incur costs before the date of the offer letter. Any costs which someone else is paying for, whether in cash or in kind. Funds to build up a reserve or surplus. The prospectus also got some tips on preparing a good application. Obviously, you can also get in touch with Nyoka and myself if you need support in this area. And if you send us your draft applications, we can give you feedback on them. Grant applications are more likely to be successful if they can show the project has been carefully thought through. Your application will be assessed against set criteria. So you need to consider that you're showing you understand why the project is needed, so have the evidence of need in there. You know what your project, what impact your project will have in terms of the outcomes, number of people will benefit, how often they'll take part. You know how you will deliver the project and measure its success. So monitoring has already been mentioned. You can sustain the benefit of the project beyond the life of the grant. So are there other sources of income you've looked at in terms of sustaining the project in the long term? be other grant funders or crowdfunding or other kinds of things like that. Your application will be assessed on a score out of 100. Applications need to score above 70 to be considered. They've broken down the scoring as follows. So project proposal up to 30 points. Outcomes, impacted activity up to 30 points. Budget details and project costings up to 20 points. Plans for continuation of the project when the funding ends up to 10 points. And references up to 10 points. You need to get supporting documents along with your application. So your governing document constitution. If you're a newly formed group and you don't have this yet, then you will need evidence of your own bank account. Your most recent financial accounts. Again, if you're a new organisation, please submit a 3-year income and expenditure forecast. Last 3 bank statements. If you're a new organisation, provide evidence that you have a bank account again. Safeguarding policies, if they're relevant to your project. These documents should all be in the name of your organisation. And it's obviously a good idea to have your safeguarding policies updated every year as well. Copies of insurance documents. So you can also include things like photographs and letters of support directly related to the project, which you may help explain why the project is needed. Applications have to be typed. They won't accept handwritten applications. And they're pointing out you should bear in mind the following questions. How do you know the project is needed by those who you want to take part? What kind of consultation have you taken? Have you had with the potential beneficiaries, potential project users? So things like surveys, focus groups, conversations. How will your project improve the lives of participants? So again, that links back to your clear outcomes. What difference will you make? How will you deliver your project? They're suggesting designing a simple service delivery plan. How will you promote your project to ensure you reach the right people? Obviously, you can also mention that we have an e-news, we have a website, we have social media, so we can help you to promote your projects. You can mention that in your applications. Does your organisation have the right skills and experience to deliver the project? If not, who will you work with to help? Will you be able to measure the results of your project? You will need to provide a short monitoring report on the success of your project. So you will need to think about how you're going to do this. How will you ensure there is a lasting benefit from the project? Again, how will you sustain the activity after the grant ends? So long-term funding again. And again, yeah, if you need support with the application, filling the application, just get in touch with myself or Nyoka, and obviously we'll send those contact details around as part of the slides. In terms of monitoring, they're particularly looking at a breakdown of the number of different nationalities, populations, demographics that you'll will be serving. The number of unique individuals who will benefit. So stressing you have the processes in place to record this information. So they give an example there, Somali and 300 unique beneficiaries. So have those kind of processes in place. After you've applied, council officers will not follow up if you have not included the required documentation with your application. Decisions on bids will be made by a small panel of council officers. They aim to give you a decision within 4 weeks of the closing date. And they're just pointing out that the fund is limited, so they may have to turn down eligible and potentially fundable projects simply because they don't have enough money to support everything they would like to. If they don't fund your project, they will provide you with written feedback. If you are successful, you'll need to sign a grant agreement that states the purpose of the award. It contains the terms and conditions. You will also be asked to submit a short monitoring report at the end of the year showing how you've spent the grant. And again, if you have any questions, there's an email, vcsfunding@ealing.gov. Tips and advice on setting up a new project can be found at dosomethinggood.org.uk. You can also sign up to the Ealing for fundraising portal, where you can search Ealing specific funding opportunities. There's a link there where you can see the full prospectus and application form. And again, get in touch, like I said, with myself on the OPCO for further support. And like I said, I'll circulate those slides alongside the slides from NHS team on the mental health priority areas. Anyone got any questions? Neil?
Oh, hi, thank you. Can I go back to your 100% funding? We're a charitable organisation. We don't have any funds except grants and donations that come in. We can't put money in to support a project like this. Our only expenses, in essence, are the instructors we have to pay and any premises we have to pay. If I instruct, I don't charge because I'm a volunteer. How do we get across to you that we put any money in and we have to pay the instructors' fees, but as a non-executive, I can come along and give sufficient to cover the non-100%ness of it?
Yeah, I mean, I think what they're trying to get at is what kind of added value you're bringing. So, I mean, if you have volunteers, like I said, obviously you can count volunteer time in terms of things like minimum wage, London living wage. That's something that you're bringing to it quite easily. And obviously, if you have venues already, you might want to add that. But certainly, I think volunteer time is always a good one to use because, you know, if you had to pay most of the voluntary sector runs basically on volunteer time.
Absolutely.
So if you calculated all that time in terms of minimum wage or London living wage, that would be a massive amount of money. So I think the voluntary sector just inherently has a huge amount of social value in there already. So I would definitely say added volunteer time is a really good one.
And is there any sort of percentage figure? So for example, if I put in 1 day a month or something to administer it, would that be enough to get it below the 100%?
I mean, the issue is I'm not from the council, so I'm not actually the funder itself. I'm just kind of like giving, I've taken the information from the prospectus, which is quite detailed. So I would say if you've got a really specific question, there is that email address for the council. So I'd need to say email them because I couldn't really give you that specific in terms of the.
Okay, thank you. Because we're doing this with Greenwich Council already, and they didn't have an issue with the fact that they were funding the premises and instructors. But okay, thank you for
that. Jeff, you're on mute. I think you're still on mute.
I'm unmuted now. You hear me?
Go ahead.
Yeah. Yeah, I'm from Read Easy Ealing, which is a setup which is aimed at one-to-one support to help those who can speak English but can't read to be able to learn to read. We're at the moment in the sort of initial setting up stages. So we have a management board. We've got 10 coaches on already available and trained to actually teach adults to learn to read, but we haven't quite got to the point of starting yet. One of the jobs we're doing at the moment is actually building up referral agencies who can pass people on to us. And I wonder whether you had a referral service within the community voluntary service where you could refer adults who can't read onto us.
We don't have that kind of process set up, but I mean, I would say we can promote your service certainly to other groups.
Yeah.
Like I said, we have an e-news website, social media, YouTube channel. So if you send us some text information, we can definitely promote that and try and coordinate with other groups to try and we'll be able to do that, to set that up.
Okay, that's helpful. Thank you.
Anybody else?
Oh, I would like to add here, if you're looking at, you know, getting data for your application and you want to do a little bit of a study to add and increase the weight of your application, there are sites like the Ealing data site where you can get your information. We've had a session on that. And if you want to go and, you'd like to have a look at that training on how to use that particular tool, I can send the link to that also. Ian will be sending out the information, so I would add that into the email. I'll send out the link to him, which you can actually go through that training if you need it and get the information that you're looking for. So that would be in terms of creating your application.
Please, can I say something? You say the small organization with less than 50K, and since we know, since the austerity and then now the pandemic, we know so many small organizations who has been, wiped out. So, and there are some medium organizations that have been doing the frontline services of recent. So is there a possibility that you could say maybe much more than that step? Was I'm sure some organizations are doing the frontline at the moment of having 50 or less, where our experience is are more or less very many of less of them. I don't know whether some are picking up at the moment, but in our experience during the pandemic. So yeah, I mean, can we move forward? Maybe something a bit a step.
Are you saying your income's above 50?
Little bit, yeah. If you can move a step, because so small organization of recent history says more or less very many of them are not getting that income.
Well, I mean, the guidance they put in the prospectus is 50 max. So I would say if you want to get an exception, you'd have to get in touch with them and see what they said, see what they tell you.
So who is to contact? Who is to contact?
There is that email address, so I can send you that email address to contact. But yeah, I mean, the guidance they've given is 50 max. So I think they're trying to focus on the smaller groups.
Yeah, but the experience, I guess, saying how many small organizations, because you are in CBS, maybe you have knowledge. Are there new emergency of new small organizations being registered at the moment, or in existence? Have you seen many of them with less than 50,000 and more doing more frontline services during this pandemic or thereafter? Because we are all of us working a small organization, but the experience is, I found this this threshold a bit tricky, or maybe like a stumbling block for some organizations who at the moment are doing frontline services. Maybe they have 60 or 55 or something like the mediums who need this money, but can be put off.
Yeah, and I mean, I think different grant funding opportunities have different eligibility criteria. So I think you just need to find, if you're not eligible for this fund, you need to find other funds which you are eligible to apply for. And obviously, we can help you. We can help you with that in that process.
Thank you. Thank you.
Yeah, and as the session Jaco was referring to, we did recently have a session about accessing Ealing data that was recorded. So we can send you the link to watch that. I'll also be doing a session next week on online research tools. So I'll send you a link if you want to sign up for that as well. And like I said, it's a good idea to do your own, as well as accessing the hard data, the hard statistics from sort of government sources and things like ONS, London Data Store, Ealing Council. You can also do your own research in terms of who the beneficiaries would be. Like I said, through things like surveys, focus groups, informal sort of conversations. So it's a good idea to have your own show you've done your own consultation as well to get that local evidence of need. And obviously we can help you with that if you've any questions about how you can how you want to carry that out. There's lots of online tools you can use in terms of sending out surveys.
We also run updates on new available funding options practically every week. So if you're interested in that, you can send us an email because and if you're not already on our newsletter, do send me an email to add you in, so you get regular updates coming into you. The newsletter may not have all the funding options, but the session which Ian and I run every week, we've got more updates on there. So do join us. It's usually on a Friday at 2:30. But we do have other sessions. Yeah.
Yeah, we do arrange workshops with funders where they have the staff to actually come present. So we've had a couple this week on a digital fund and also on
Lloyd's
Bank Foundation. So there's a recording of that session, which I can also circulate. Unfortunately, yeah, we've got another one coming up with Trust for London, which is a Pan-London funder. That's coming up in July. Unfortunately, a lot of the smaller trusts and foundations don't have any staff that they can send out to sort of promote the funds. So we do our best to promote those, but there's a huge number out there. So it's a question of doing the research to find the grant funders which are where you're eligible, and just to keep applying. And obviously, the more you apply for, you just increase your chances of success. And obviously, be aware. I mean, the council fund, you know, it's only once a year. It's a relatively limited pot, so you just need to keep applying to as many sources as possible, really.
Yeah. So if you don't really fit into this criteria, if there's any areas like Yusuf mentioned, you're about 50,000, then you should go ahead and explore other opportunities which are available at this point and open. We have put in a little link in the chat box. We'd like you to click on that before you leave today, because this would help us actually bring more sessions to you and tailor our sessions and get them more effective. So to click on that little form there, it won't take you more than 2 minutes to just give us your quick valuable feedback on today's session. If there are no more other questions for Ian and me.
Thank you.
Thank you very much.
Thank you, Lola.
Thanks.
Thank you, everybody.
Thank you.
Have a lovely day, and we'll send the slides and the recording, the link to the recording